So please join me in welcoming our keynote today, which is How to Be the CEO of Your Own Health by Dr. Erin Nance.
Good morning, Oley Foundation. When Beth invited me to speak, I said, what, and get the opportunity to meet 500 of the most badass people in the world?
Woo-hoo!
Thank you, sign me up. My name is Dr. Erin Nance. I'm an orthopedic surgeon from New York City, and some of you might know me as Little Misdiagnosed from TikTok, for anyone who's on TikTok. And I want to start with a story. Like all good stories, it starts with someone sliding into my DMs. And if you don't know what that is, find the nearest teenager and they'll tell you. So I was minding my own business online. I had no online presence. I had a private account. And I had a message. And in the subject line was desperate, in all caps with 5 exclamation points. So I open it up. It says, "Dear Dr. Nance, I don't normally talk to strangers on the internet, but I'm desperate. I have had 10 years of severe fingernail pain, and nobody can tell me what's wrong with me. If you just brush the tip of my finger, it kills. If I accidentally knack it on something, pain through the roof. And I've seen 5 doctors. They can't find anything wrong. In fact, I think I'm going crazy. Can you please help?" So because I couldn't help myself, I messaged her back and I said, "Dear so-and-so, I too do not normally talk to strangers on the internet. But do you have a little blue dot under your fingernail?" And she responded within about 30 seconds, "Yes, I do have a little blue dot under my fingernail." I told her, "Listen, you're going to go back to your doctor, ask to get an MRI of your finger. It's going to show you have a glomus tumor. You're going to find a hand surgeon, they're going to take that tumor out, and you're going to be cured instantly." So I didn't hear much for 5-6 weeks. Then I get another message in my inbox, this time with the subject line, "OMG." So I open it up. It says, "Dr. Nance, I talked to my doctor. We got the MRI. It showed a glomus tumor. I had surgery last week, and I have no more pain. Thank you, thank you, thank you." So after this interaction, I thought, why did it take this woman 10 years to get a diagnosis? She saw 5 doctors. It wasn't as if she wasn't trying to get help. And what I've learned over the past year, over 100 million views on social media, and befriending 700,000 people who I learned from their stories more than my stories, is that there is a way to get the answers that you need. Now, I go to a lot of talks, a lot of conferences, and I can't remember a single thing from any keynote speaker that's ever said anything from any of these talks. But I am going to tell you 3 Yoda-like things that I want you to remember. And what I want you to do right now is take out your phone. You won't hurt my feelings. Take out your phone, and I want you to pull up your notes app or write a text message to yourself, and I want you to write these 3 things down. Because these are the 3 things that in 6 months, in 1 year, in 5 years, when something is just not going right, something is off, and you need to think back of what can you do to move forward, I want you to think of these 3 things. So number 1, the eyes only see what the mind knows. The eyes only see what the mind knows. Number 2, lay your cards out on the table. Lay your cards out on the table. And number 3, and this is probably the most important question you could ask your doctor, what else could it be? What else could it be? Number 1, the eyes only see what the mind knows. This is the only piece of wisdom that stuck with me after 10 years of medical and surgical training. And this is to say that not every doctor knows everything, right? Let's go back to that glomus tumor story. That woman saw 5 doctors, but because those doctors didn't know what a glomus tumor was, she was never going to be diagnosed with a glomus tumor. Okay? I'm going to say something that may be a bit controversial. I believe that you know more about your disease than 99% of the doctors that you will encounter. And this is not to discount some of the amazing experts that you work with, amazing experts who are here in this room who are going to give talks. But you are going to be encountering primary care physicians, pediatricians, emergency room doctors, dentists, orthopedic surgeons, physical therapists, okay? And they do not know as much as you do. So that's to keep in the background. Another issue, sometimes the information that doctors know is either wrong or biased. This is a picture of Dr. Richard Tayland. He was one of the pioneering OBGYN surgeons out of Johns Hopkins in the early 20th century. Dr. Tayland had a private practice of primarily white, upper-class women, and then he also saw patients in the City Hospital of Baltimore, primarily Black women, lower socioeconomic status. And Dr. Tayland published a paper called Endometriosis, the Scourge of White Upper-Class Women. Because that's all he saw. He saw women, white women, in his private clinic who had endometriosis, which if you don't know what endometriosis is, it's a very painful, debilitating problem where the inside of a woman's uterine lining is on the outside. Think of having a painful period all over your body all of the time. So for generations, OBGYNs were taught that Black women did not have endometriosis, which led to millions of women being misdiagnosed or undiagnosed. So again, all of those OBGYNs, the eyes only see what the mind knows. And sometimes what the mind knows is incorrect. I looked up on WebMD and the Mayo Clinic website, kind of what are some of the common ways people may get gastroparesis, something that I know a lot of people in this room suffer from. And there is a long list. There are a lot of ways, there are a lot of reasons why you could have gastroparesis that most doctors are familiar with. But then I went over to Reddit. What's the #1 post about why people have gastroparesis? I have Ehlers-Danlos. Ehlers-Danlos was not mentioned on either of those lists. And those are the lists that most people are looking to and thinking of when they think why I could have gastroparesis. All right, #2, lay your cards out on the table. How many of you have filled out one of these forms? How many of you filled out 100 of these forms? Okay. These forms really just exist for accounting purposes, all right? Sometimes after a visit, I may see 100 patients, and at the end of the day, I may have to go back and reference this form. But if there is something that is really important that you need the doctor to know, you cannot just rely on these forms to get that information across. If you have an anaphylactic allergy to latex gloves, you need to have that front and center, okay? So don't rely on these to get it done. I want to tell 2 quick stories about how my interactions with patients can change based on the information or lack of information they give me. The first is I had a new patient. It's a teenage boy, came in with his mother. I know a lot of people here are parents who are helping with their their children's illnesses. And I walked in, I said, "Hi, I'm Dr. Nance, so nice to meet you." He said, "Hi, I have autism." And I was taken aback. No one had introduced themselves like that to me before. But it made me kind of reframe the visit. And what I noticed was I could see how the patient was getting so frustrated with his mother, who was answering for him, who was interjecting, who wanted me to talk to her and not the patient. And it forced me to be a lot more focused and clear and direct with the patient to understand what were the best communication needs for him. And so if you have a certain communication style, you like to hear more about facts, you like to hear more about patient stories, let your doctor know. The second story is I had a new patient come to see me, a 60-year-old woman, and she had a big bump on her wrist. So I went through the whole history, comprehensive physical exam, we did the x-ray. I said, "I believe you have what's called a dorsal ganglion cyst." I went through all of the treatment options, what the recovery period would be like, and after 20 minutes of this appointment, she said, "So do I have cancer?" And I wish I knew that this whole time, that's all she cared about. I could have alleviated her worries within the first 10 seconds of seeing her if I knew that that was what she really cared about, what she really wanted to know. So it helps us, doctors, with how we communicate with you if you lay your cards out on the table. The next is, what else could it be? Every medical student, every resident goes through training. We learn the process of coming up with a differential diagnosis. If you've ever seen House or Grey's Anatomy, when they're pimping the students, they're asking for a list of the 10 things it could be. And what happens is you may have a disease that is fairly rare, difficult to diagnose, and you're just not getting an answer. Or you may even have a diagnosis, but all of the symptoms, not all the dots are being connected. There are some unexplained things, and you think, I think there's something else going on. And so the most important question you can ask your doctor is, what else could it be? I know you think that it's this, but what else could it be? If you find yourself, you're at a roadblock, they have exhausted all of the tests for this one thing, particular disease they think it is, you ask, what else could it be? Now, I know a lot of people in this room, their children have had G-tubes, so I wanted to look into a particular problem, and these are just the main complications after having G-tube surgery. Now, number one, I want to point out, and I am so sorry for anyone who has ever had this procedure or their child who has undergone this procedure. This is over a 100% complication rate, okay? If someone came to my office and I told them, I'm going to do a surgery and 100% of the time you're going to have a complication, that would make me feel awful as a surgeon. I just want to acknowledge how difficult this problem is. But if you think something is not right, something's just off with this G-tube, it's not working properly, these are just 5, 6 things that if you didn't know about or you didn't think about could be the cause of the problem, then you could be spending a lot of time going down one path when there could be other paths. Also, another problem, a lot of people come unintentional weight loss. Look at these lists. There are 20 different possibilities. And if you've only explored 1 or 2 paths, and you may not even know that these are other possible reasons why you could have unintentional weight loss. So in the end, these 3 things to remember: the eyes only see what the mind knows, lay your cards on the table, what else could it be? But what can I do to help you synthesize all this information and help you move forward. So today, I'm extremely excited to announce that we have launched a partnership with the Oley Foundation for the Oley members to be the first users of a health-focused social network, because I believe that you have the answers, that the answers are hiding in plain sight. But because there's so much information out there, it's fragmented, you don't know who to trust. If you have gastroparesis, there is no one you trust more than someone else who has gastroparesis. If your child has a G-tube, there is no one else you trust more than another parent whose child also has a G-tube. So I believe in the power of peer-to-peer health and storytelling to help give information that's valuable to people. And Feel Better is a safe and trusted place for people to share and receive health information. This is the website if the QR code isn't acting up. Okay, so this is the website, feelbetter.health. I'm gonna take a picture of that. And now, I have a little surprise. So we are actually going to be speaking with one of your members to hear her story and to learn from her so that maybe just one of you doesn't have to go through what you're going through. So I'd like to welcome Jessica up to the stage, and we're going to be doing a live podcast recording for the first podcast for Feel Better. It's called The Medical Detectives. And Jessica has so graciously offered to share her story so that we can learn. All right, so Jessica, thank you so much for joining us in The Medical Detectives.
Thank you for this opportunity. This is really cool. I'm really excited.
So can you tell us what is your intention in sharing your story?
So I've learned over the past few years since I've been diagnosed with a crazy amount of things, it's kind of been very therapeutic in a sense. I've noticed talking about these things has lifted a weight off my chest. It makes me feel, in a sense, less alone, knowing that someone else is hearing my side of what's going on and not necessarily someone who's witnessing what's going on, because we're all living with our diagnosis and our illnesses at the end of the day, right? So that's been a big thing. And then just also letting others who are also struggling with maybe similar situations, similar illnesses, similar treatments, just a sense of not feeling as alone. And hopefully it can help spark ideas on how to approach certain problems and how to avoid other ones. Now, not everyone's situation is the same. Everyone has different experiences with same doctors, etc. So at the end of the day, it just helps, I feel, connect people on a more personal level, because dealing with all these illnesses, it's no easy task. So just having that friend that also gets it, it's just so fulfilling, like being here at the conference. So I really hope that helps a lot of people on different aspects.
Can you talk about what life was like as a child for you?
So I was actually really, really healthy. I think like when flu season would come around, strep, I went to public school, so all the germs, right? I probably only had the flu like one time ever when I was a kid, never got strep throat like everyone else did. I loved to play sports. I was a competitive dancer in high school. I did color guard and marching band. And then after high school, I pursued a career in firefighting and EMS. And I was in the best shape of my life at that point. And it was just crazy because everything, once I hit like 18, 19 years old, it just went downhill.
What was the first sign that something was not right?
So this wasn't technically related to what's going on now, but I had an ovarian cyst rupture. And then that became really frequent, of like every other month, and just female problems, right? But then the day of my brother's graduation from high school in 2019, I was having really bad abdominal pain all day. I got really sick, and I was like, oh, it just must be another ovarian cyst. I'll just ride it out. Took some Zofran, I'll be fine. And it didn't stop. And I went to the ER eventually, and I had a CT scan, and I had my first bowel obstruction. And everyone at the ER was baffled because I didn't know a lot about this at the time, about bowel obstructions. We weren't trained about these much in my schooling. But they were like, have you ever had any abdominal surgeries that aren't recorded? And I was like, no, I've never had surgery like that. So that's when it all started.
And for someone who was very healthy and then had this acute event, did you think, okay, well, this is one thing and I'll just, soldier through it?
At first, yes. I was like, oh, it just must be a little blip in the matrix, right? And it turned out that was not just a little blip. I continued with my job. I worked 48 hours. I was off for 96 at the fire department. And then it started to be where I would get bowel obstructions every 4 months, and then it turned into every month. And I would be admitted every single time. I would get an NG tube every single time. They would never do surgery because it seemed like there was no physical obstruction. And it got to a point, I was like, why do you keep admitting me and telling me there's something wrong, but you're not trying to figure out what the root of that problem is? Like, you're taking me out of my job. I'm not making money. Like, I have to make money to live, as I lived on my own. And it was being very detrimental to my life, and it was just so hard to, like, hey, get me a GI doctor. Hey, get me a GI doctor. And in the area I'm from, we only have a few, and they're usually the ones that deal with colon cancer and other like common GI abnormalities. But I finally got in with one, and I want to say that was, sorry y'all, I get cotton mouth really bad, so you'll see me like that. I want to say it was like at the end of 2019, and I kept asking, like, you would think you would need a colonoscopy or an endoscopy after that certain point if you're being admitted and admitted and admitted. But no, thank you. Maisie to the rescue. And no, they refused to do scopes of any sorts. They were like, just normal blood tests are fine. And I'm like, I don't want to keep being admitted for these things. They're painful. I don't like being sick. This is not fun. No one likes to be sick, right? And it was absolutely miserable. And they took my gallbladder out. That's all they did.
And at this point, do you know anyone who is going through similar things, or had you been able to find other people who had gone through similar things at a similar age?
So in terms of further down the line of my journey, yes, because I'm currently working towards evaluation for multivisceral transplant. At the end of the day, a few years past, I was diagnosed with chronic intestinal pseudoobstruction. I've been genetic tested. It was genetic, but I'm scheduled to go through my transplant evaluation testing here in August at a hospital. But I've talked to a few people who are going through the same thing. They're like, oh my gosh, my GI doctor, my nutritionist, or whoever is like referring me to the transplant team. What do I do? This is all so scary. And I understand that. I mean, I've been dealing with like deciding on transplant since 2020. And shockingly, I'm now okay. I'm not as scared and nervous with the whole process anymore because I actually met 2 people that helped me from Oley last year that I talked to over the past few months. So now I'm getting to like explain that beginning process to someone else who's same age as me and going through very similar circumstances, and I'm glad I'm able to, because I wish I had that at the beginning.
So go back to you're just frequently going in and out of the ER. No one is finding the root cause of the problem. How did you get from almost no intervention to being put up for a transplant?
Yeah, that's a big story. So in my state, we didn't have the resources for like IV nutrition, and tube feeding in general was extremely like not a common thing at all. It was barely ever heard of. I had a wonderful primary care doctor. I met her whenever I started getting so sick, I couldn't work at the fire department anymore, so I transitioned to be at an urgent care because it was not doing as many crazy things, and she was a provider there, and I really connected with her. So she had watched me deteriorate because I had an obstruction back in August of 2020, and after that I dropped like 60 to 80 pounds in the span of 2 months. I was severely malnourished, constantly dehydrated, and she was like, we've got to get you out of this state into a place that can figure out what's going on, because this isn't just some like common thing. And I was referred up to a place 13 hours away from my town, and I had a few appointments with them and got the testing I needed, you know, your gastric emptying, your scopes, all of those things. And at first, I was really discouraged because I got a call saying they all came back normal. I was like really scared, and like you mentioned in your talk earlier about, am I going crazy? Am I making this up? Like, what is happening? But I was really surprised to see this GI doctor. He's like, but we're not gonna just give up on that. So he took time to do even a little bit more research and talking to colleagues of his own, and I got a call while I was at work. At this point, I'm on an NJ tube, so I'm getting enteral feedings. And I was told that I have intestine failure and that he highly suspects a dysmotility disorder called chronic intestinal pseudoobstruction, and that he wants to proceed with my care by referring me to the GI transplant and gut rehab team, because I wound up failing my enteral feeds. I couldn't keep a tube down long enough. I was still getting sick. My feeds were causing obstructions. So at the end of October, I started TPN. My primary care doctor ordered it. She took care of it. And like I said, I'm very, very blessed to have her and that she knew about all of this stuff. So she saved my life in a sense. And then I met the transplant team, and I was given a choice to either go through the gut rehab surgery, which is an autologous gut procedure or a trifecta procedure, or do the transplant now. And it was kind of interesting how it was presented to me. It basically was told you can choose one or the other. There's no right or wrong answer. And I'm over here like, I don't have experience with this. My family, like, I don't know what's happening. This is all moving so quick. Like, when I tell you this is moving so quick, this happened in a span between August 2020 and November 2020. So I'm like, I'm still trying to process that I'm I'm getting fed through an IV now. Like, and then having to go on disability, quitting my dream job. So there's a mic there. So it was so much to process. And then having to go 13 hours away for care, that was a big, big, big stressor. But it was really interesting because my transplant surgeon at the time, he handed me his research papers, his case study reports about both procedures. And I was told, here's some information, these are the facts, this is the information we have gathered. You seem to be a smart girl. You make your decision. And I'm like, no, I'm like 21. I'm not, no. So yeah, I was like, okay, I'll read them, because I like reading that stuff, I'm a nerd. But I was like, I don't know how to make this decision. That sounds scary. 5 organs? So those who don't know what a multivisceral transplant is, that consists of the liver, pancreas, small and large intestine, and the stomach. Sounds risky, right? That's 5 organs. So I went ahead and just decided to do the reconstruction surgery. And so I did that, and I had that done in March of 2021. I woke up from the surgery. It was a success. Everything went well. They said I needed to move to this state. It was not safe for me to go home because when they opened me up, they realized my bowel was way more diseased than they theorized, because this type of stuff doesn't show up on scans. It doesn't show up in the blood test. It doesn't show up in the scopes. It's just that complicated. And there's so many other diseases, and I'm sure you guys have them, that are just that complicated. We don't have the testing for that. And so I moved to that
How did
state.
that feel to just move to a different state? You've already given up your career. You are, I'm assuming, isolated from your family, who's
Yes,
not
they
with you.
stayed in Arkansas. My mom, my siblings, my sister was still in high school. So they stayed in my home state. It was very, very hard. I've always been pretty independent since I was a teenager, but that doesn't mean I want to be alone. And going through all of the in-between appointments, the procedures, the constant ups and downs, the good days, the bad days, being 13 hours away from my mom, who's one of my biggest supporters. She's the reason I was able to have the opportunity to stay and get the help I needed, because I know not everybody has that capability, and that is so messed up of our medical system. It was just really, really hard, but I made friends in my new state. Unfortunately, no longer friends with them because I got really sick, and it's just sometimes it's too hard for some people to deal with, and I understand that. I'm heartbroken at the end of the day, but I respect it. So it's been really hard, but good news, I'm at a point now this year where I'm able to move back home here at the end of July to be with my family for this next part, so I'm really happy about that. But it was really difficult, especially when I was getting a new diagnosis. All these things, I didn't know what was wrong with me. After all these years, I thought I was just being tired or fatigued, or, oh, it's just a stomach bug. It wasn't a stomach bug.
Now, most surgeries, and certainly massive ones like yours, come with blips in the road, and it's usually not a straight path to recovery. No. Can you kind of talk about that path?
Yeah, so the surgery's done. 2 months later, I was actually able to get off of TPN. I was eating soft GI diet. I was great. I was like, yes, I am on the mend. This is great. I made the right choice. And then a few months later, I started having a lot of complications. My bladder paralyzed. I was stuck straight cathing. Apparently, it is a complication from the disease I have. And at this point, I still haven't seen genetics, so we don't know it's genetic. But my bladder paralyzes. I wind up having to have a procedure for an interstem pacemaker deal. It stimulates the nerves in your back so I can release and let the urine flow. So no more UTIs, right? So I got that done. I was able to go to the bathroom again. My pain started coming back in my abdomen, this constant abdominal pain. Every time I ate, every time I woke up, every time I took a medication. And it just kept getting worse and worse over the years, and I wound up starting ketamine infusions. I went down the whole route with pain management. We've tried the patches and everything. And actually this year, back in January, I had an intrathecal pain pump implanted. I also have POTS. My heart does not like to listen to my body. I also have Ehlers-Danlos. Also PCOS. Endometriosis was also discovered, pelvic floor dysfunction. It's just been a wild ride. And then my GI symptoms came back full force, and my surgeon was saying you probably only have about 2 years with this surgery, and which is really funny because when our doctors ever like pinpoint on their things, because I got off of TPN May of 2021, started TPN again May 2023, the exact same day I was taken off. So that was crazy.
Can you talk a little bit about being a pain patient? I think there's a lot of stigma around people who have chronic illness and also chronic pain.
Oh, that was really, really hard. It was always dismissed for the longest time. Like before it was like really confirmed, I do have these GI problems. It was always like, oh, it's just period cramps. Oh, your cycle's just off. Oh, it's just a stomach bug. Oh, you're being dramatic. Oh, all these things. And I'm like, I like to think I have a pretty high pain tolerance, but that's just my opinion. I mean, tattoos didn't hurt. But it took a lot of trying to find the right doctor, and it's exhausting. And I get when people are like, I don't want to do that. Like trying to get appointments with all these specialists, it's a pain in the neck. And eventually I connected with one that was just really great. And the fact that he was able to comprehend the oral aspect, like I'm not absorbing oral medications. And a lot of doctors don't tend to acknowledge that, because I've had issues with doctors and patients, like residents, attendings, you name it, all across the board. And it's because they're not able, I don't feel like they were educated enough in this. And I know that can be difficult, but, oh, you can take it, you'll absorb some of it. I was given tablet melatonin to help with my sleep, even though melatonin never worked when my stomach worked. I got sick, even though I told them. I've been given so many medications thrown down my throat, never helped, and just get sick. I get worse because nothing's helping. But with the pain things, we eventually went to patches. Those were great for a while. And then I started developing a bunch of allergies to random little things. I became allergic to the adhesives on the patches. And then we tried the intranasal ketamine, and I started getting sinus infections. I was just like, my luck is not working out for me. I need to go get a 4-leaf clover or something, right? But then we went to the intrathecal pain pump because it was just the last option. I mean, because like my pain was legit. My vital signs show it, my inflammation markers show it, and sometimes even when those showed it, like when I'd be admitted, those doctors, they would see those things, but they'd still be like, you're not hurting, you're being dramatic. And it's like, but it says otherwise. So kind of, it's been hard with the pain. And I know I've been very fortunate to get the help that I needed. I know that. And I know that's not always the case for everybody, and that's absolutely frustrating because pain is such a hard thing to deal with in this community.
I talk on my platform about medical PTSD, meaning the mental distress that doctors and the healthcare system impose on patients, specifically patients with chronic illness, due to just the exhaustion of the process. Can you talk about that process?
It takes such a toll on you mentally. And then that's just like the communication part. That's not including going through all the procedures, all the testing, hitting all the dead ends, going through medication after medication after medication, therapies, like the admissions. It's a never-ending cycle in so many different aspects. And then also just being so fed up with your body not listening, and you're just like, please let this be what fixes me, or let this be what alleviates my symptoms, and it just doesn't. It's absolutely just exhausting. It's like chipping away at a stone and until you're just nothing but dust. And I'm gonna be real with y'all for a second, because I know this can be a taboo thing, but I think it needs to be talked about, and I want people who haven't heard people talk about this to know they're not alone. It's okay to have hard days. I had a really tough time at one point because I wasn't being listened to. I felt like I was wasting away. I had a crisis and I got the help I needed, but there is light around the corner. And it was really interesting. My saving grace from that was finding a community like this. And I think that was one of the biggest things that helped me learn to cope and heal from that trauma that I've gone through. Those issues I've gone through is just finding people that get it. That's what's so special about Oley and the connections and being able to have a friend you can get a hold of that just gets it. Because I've had so many different doctors who I'll try to tell these things and they don't get it. Instead, they're more interested in my diagnosis and what's it about. And I'm like, no, that's not what we're here for. But just having that community has been very healing, and then knowing other people also struggle makes me feel less alone and not as crazy about the whole process. So that was really comforting.
What do you say to people who, it sounds like you had a couple of doctors along the way who really went the extra mile, right? That primary care doctor who was able to see your transformation and say, this is not okay, we have to act. What do you say to people who feel like they haven't maybe found that person, that doctor advocate in their life yet?
Never give up. I know it's very exhausting. It is so exhausting, and resources are limited, and I understand not everyone can afford to go to and far. And it's very tedious, but eventually you can find that right provider. Kind of like how some mental health providers will stress, like, find a therapist that you click with. Find a doctor that you can click with. Or if you have one doctor that you really do click with, talk to them about other providers. Doctors are connected too. They know people. So talk to them, ask and see what they think. Research is good. I know the internet can be really sketchy. I'm not saying rely on everything the internet says, because the internet is not always right. Also, like, connecting with people while you're here at conference. That was a big thing. I learned about a lot of different providers that seem to be really well educated in dysmotility problems. So through people I've met, so that was really nice. But don't give up. And sometimes it takes time. I know it's hard to not get impatient, but just don't give up, okay?
And what's on the horizon for you, for your medical journey and story?
So I know what the plan is, but plans can always change. Like I said, I'm supposed to go to my new transplant center. Here in August, I will go through my testing evaluation, basically to make sure I'm like capable to go through the surgery and like specific bits about my anatomy, as it's a big procedure. So as long as that all goes well, I'll be listed, and I'll probably have to move again for just a short period of time though, thankfully, because they've been very transparent about the time frame I'll have to stay there. I am nervous to move back home. I'm not gonna lie, here next month, because there's not many resources there that are good at managing my type of disease and nutrition support. Thankfully, I'm gonna get to keep my nutritionist at my current hospital where I moved to. She's been fantastic. So it's a bit planned, but also a bit unknown, because everything might be going good, but some weird thing will just come up, like an infection or some other just weird symptom will come up and it'll be something else. But holding on to that things are gonna go good, just trying to stay in that positive mindset has been a great thing to help me stay in a good mood and give me the energy to keep pushing forward. Because that's the thing, I want to get to a place that I'm not in the hospital every other month, because there's so much I want to do. Like, I love to help people. That's why I went into the career I did initially. And I want to be able to do that again. And even if it's not specifically in medicine, I want to help people. But that's kind of where my road's going right now.
Well, thank you for being so open and honest and sharing your story. If there's one piece of advice for someone who is just maybe starting their medical journey, what would it be?
One thing is, write down your questions. Everything you're unsure of, write it down so you don't forget. And I would say the biggest piece of advice I can get is take advantage of this conference. Connect with everyone here or those you can. You can learn a lot. People can help with those questions that you have, like what's it like living on TPN? Like there's so many people here. Like I've only been on it for a few years. There's people here that have been on tube feeding or TPN or oral nutrition for long amounts of their life. And that was another thing, like I know Beth mentioned it earlier, like knowing that, oh, you could have kids. And like, I didn't know that. And then like traveling, I didn't know I could fly on a plane with TPN. And it's like questions like those, you can get a lot of those answered and just getting to learn those types of from those types of people here. But writing those questions down, asking them is a great place to start. And keeping a positive attitude, even though I know it's really hard. Find those people that help bring that out of you. Find those people that make you smile and keep them close, because they will be a night and day difference in your life.
Well, thank you, Jessica, for sharing your story. And
thank you.
Very brave. And I think I have a little bit of time extra for anyone who has any questions, happy to answer. Oh, the mic.
You guys? Okay, now it's on. My question is, I know you came to the Oley Foundation and that your first interview was with Jessica, who's, intestinal rehab. Are you continuing with more interviews for like gut-related issues, or are you trying to go outside of that scope as well?
So I believe that there's too much information siloed by disease. And what really people are trying to do is just get better, trying to cure their symptoms. Sometimes it does help when you do have the disease categorized, but what I'm interested is amplifying people's stories, that people can find some connection, whether it's through symptom of nausea, vomiting, bowel, bladder issues, because what you may not realize is that you may have something in common with someone who has cancer, or someone who has a connective tissue disorder disease. So we're trying to build kind of this large database of people's stories so that we can help connect the dots. So we're starting with the Oley members because it's great that you all have a similar treatment, but you have many different ways of how you got there. So we're open to everyone telling their story. This particular, The Medical Detectives is a podcast series that a producer in LA is putting on. It actually isn't even out yet. But for anyone who has a story that they would like to tell in this kind of long format, you can contact me directly and we'll go from there.
We have one over here.
Hi, is it on? All right, I'd just be interested to know what suggestions you might have for people who are in, like Michelle, under-resourced areas, or people in marginalized groups who already have health equity issues and access issues. How might you recommend they go about being the CEO of their own health and kind of taking charge of this when sometimes they're not even believed?
Thank you for the question.
So there are a lot of resources out there that take, unfortunately, a fair amount of digging. So even pretty much any pharmaceutical company, they will have different vouchers. And I just did this post where someone told me that they bought their medical device on a Black Friday sale. Yep. I said, or someone told me, I use Groupon for my prescription medications. So I think that there are incredible resources that actually, again, the patients know more about those kind of tips and tricks. And that's kind of what I talk about on my social platform. So yes, connecting and learning about those issues, but just the ones that I specifically know about are that if you work with a certain medication or device, a lot of those manufacturers do have rebates, things outside of your insurance status. So trust me, I know how difficult it is to get on that phone and be on that phone for hours with your insurance carrier, but there are kind of other ways, and I would first go direct to the company for looking for those things.
That's good. Patients and their families know symptoms and some tests. Any doctor, as good as they may be, cannot know everything that's going on. So my question is, how AI can solve the problem into the future in terms of searching worldwide for everybody's experience?
Thank you. So that's a phenomenal question. I think the use of AI it will revolutionize how information is accessed and categorized. But one major problem that I see is that the use of AI is based on the information that we already have public. Yes. So for example, 96% of all research studies have been done on men and for male symptoms. So when you go to WebMD and when you go to the Mayo Clinic, you are going to see those symptoms that are based on studies based on men. So you can have the smartest AI algorithm. They are just combining data that misses 50% of the population. And that's why I believe this peer-to-peer health, okay, using that data is the most helpful. Because yes, AI is helpful to aggregate large sources of data, right? There's no reason in 2024, if you have gastroparesis, no one in your family has gastroparesis, none of your friends have gastroparesis, but there's no reason for you to feel alone because there are thousands of people across the country, across the world who have gastroparesis. And that's why tools like AI, like social media, social networks are really going to help people feel connected.
Thanks for your talk, and I love your point number 3 about asking what else could it be, because when you often have a diagnosis, they like to just, especially a complex diagnosis, they like to say, oh, it's just part of that diagnosis instead of digging further. So what would you say when you are asking that, what else could it be? What other insights can you say around the complex diagnosis and then keep going back to, no, it is just your mitochondrial myopathy. It's part of that. The symptoms are all related to that.
Mm-hmm. I like when a patient comes in with research. I know that's not every doctor, and some doctors feel annoyed. Some people, there used to be some, magnet, don't confuse my MD for your Google search or whatnot. Okay, those are not the doctors you want to be working with. And I understand that not everyone has a choice. But most doctors will welcome, your input and welcome the work that you have done. And that's why I think it's helpful to have a little bit of that research done before you come to your appointment. Because as we said, not every doctor knows everything, right? That woman finding me to diagnose her glomus tumors, that was like finding a needle in the haystack on TikTok, okay? But I think if you do your research and you recognize, again, social media is a great place to find patterns of similar symptoms. You may not have the exact same problem that someone else that you see on social media has, but you may recognize similar patterns, and that can be a jumping off point for you to have that discussion with your doctor. Because in the end, they're the ones who are going to be able to synthesize all that information and say, that's right, maybe you could have this. And then that leads to additional testing or having another conversation. But I think it is really important, even if you have a diagnosis, I believe that for most people, especially if you have an autoimmune disorder, if you have one problem wrong with you, you probably have 5. And it's just that it hasn't been diagnosed or given a name to it.
Thank you.
Hi. So I'm hoping my brain doesn't just stop working on me in this exact moment. But I was thinking about like when you go, like when I go to the doctor and I like present with a certain symptom for like gastroparesis specifically, like even though my symptoms, like when your symptoms don't line up with what like the DSM-5 or like what the internet says, or like you're like the one with the odd symptoms, like how do you get your doctor, or like how do you talk to a provider so that they like not take you seriously, but in a sense like understand that like everyone's body is going to respond differently? Like there's a wide variety of symptoms, and just because I don't present as like textbook doesn't mean that this isn't something wrong with me, because I've had this conversation with a lot of different diagnoses like POTS and gastroparesis and EDS, and like doctors are just like, oh well, I mean like you kind of fit the bill, but like we don't really know. Is there like a way to communicate with your providers and like, because I feel like what you said about like you only know what your eyes can see, and so if they're only seeing what this like standard is, then they're not really realizing that there's more outside of that.
Yeah. That's a really common problem, is that, for example, if anyone knows what Ehlers-Danlos syndrome is, as a med student, I was taught it's a condition where you have stretchy skin and really hyper-flexible joints, okay? Well, it turns out that it is part of a connective tissue disorder, and that same stretchiness in your skin leads to stretchiness in your stomach, leads to stretchiness in your gut, and so you can no longer properly peristalse. But to have a diagnosis of Ehlers-Danlos, there is a criteria called the Baton score. Now, again, this goes back to how these criteria got set in the first place. This criteria was never meant for Ehlers-Danlos. This was, there was a doctor who was doing a research study in South Africa, and they needed a quick way to just put people in camps. Okay, maybe you're hypermobile, maybe you're not. And they came up with this 9-point scale, and for some reason, that became the Bible for getting a diagnosis of Ehlers-Danlos. And the importance of getting a diagnosis is that, again, this is a bigger healthcare topic, but a lot of the treatments, how those get covered, depend on the ICD-10 codes that you are given. And a lot of times doctors, they are a bit hesitant to give you a diagnosis because they may not feel like they are the experts to give you that diagnosis. And I understand that hesitancy. It's very common in rheumatologic conditions, where you look, you sound, everything seems like lupus, but your primary care doctor is like, well, I'm not the rheumatologist, so I don't feel comfortable being the one giving you that diagnosis. And one of the tips that I spoke to people in my group, my followers, I will ask them to talk to their doctors who they have good relationships, right? They have trust relationships, and ask, could you give me a working diagnosis? Okay. That kind of takes a little bit of the pressure off of the doctor who's, they may not feel comfortable saying, yes, you have Ehlers-Danlos, yes, you have rheumatoid, but just giving that working diagnosis allows you to then have access to maybe a different specialist or try a different test to go down that path. So that's kind of a workaround that I have come across, to ask if we could consider this a working diagnosis.
What a great tip.
I have a question. So my daughter was born with short gut. She's 3 years old, and it takes time to find out, because it's so rare. But I know a lot of us have a lot of things in common, and you're going to do the group, the Oley group and stuff like that. My question is, we're lucky enough to be here, but I like to think ahead. Is there something that you guys could do? I know we're going to do the group, and you can communicate with each other with the rare diseases and stuff. Is there any way where you guys can connect with doctors around the States at least, so that when they see like, okay, this kid has shortcut, I recommend you at least have somewhere to go to that you can like, at least, you know, because it might take 5 years to find out about this convention, or you might know about it, but you can't even go to it. Or you might, you know, just to like go online would be helpful or stuff like that. Is there anything that we're doing as far as, or you guys are doing as Oley to try and make that happen, connection?
So the platform that I'm building, Feel Better, is specifically for that purpose. We want to, our goal or our vision is a place where doctor expertise and patient experience is equally valued and accessible. So we want you to have the information from doctors in your specialty, right? You may live in Arizona, but you could learn so much from the doctor here who's from Colombia, right? And then that at least gives you the information that makes you empowered to talk with your local doctors and is at least the jumping point for where to start. And you know, through the platform, we really want to elevate these doctors who are the experts, right? These are the needle in the haystack you're looking for. But if you don't know what you're looking for, you're never gonna find that needle. So the kind of the base is to elevate the education of everyone through the stories, through the learned experience, and then provide you with the solutions, which may be introducing you to the doctors who are those experts, and then to learn from patients who have been patients of theirs, right? And to understand what it was like to work with someone like this. So yeah, that is exactly what we are aiming to do with our platform, is to not only provide you the space to connect with one another, but then also provide you with the solutions that you need.
And I'll just take a moment and come back from the Oley side of things. So I'm Dave Mercer. I'm from the University of Nebraska Medical Center. And we have a big intestinal failure program, and we know lots of people here. But what Oley, so I'm going to be the next president of Oley for the next couple of years. And so what we're going to really try to do is exactly what you're saying. It's difficult in the United States because of the way care is done. It's really hard to get people into centers of excellence because there's systematic biases against that happening. There's reasons why you're held in your own state. You can't get access to other places. The information is held back. It's related to, it's nothing to do with the expert centers. It's related to kind of payers and the way your home care is done and the way your doctors work and everything else. So I think what Oley's going to try to do is help to I don't know, facilitate those interactions to try to, now your point about how do I even find out about this? Like, I've got my little baby and, I might not hear about Oley for 5 years. Well, one of the things we have to do as Oley is make sure that doesn't happen, right? So that, you can say, well, that's a failing of us. And so what we have to do is say, okay, we're gonna get out to everywhere. We have to be in every program and so that people know, because this can then be sort of the one-stop shopping that can help to connect you to a community and to other programs. But it's a tough problem. And I can tell you, if you're on the adult side of things in here, it's way worse, because adults is much more fragmented and much more challenging in the United States. It's really, really hard to find. There's giant deserts where there's no real access to care. So that's going to be one of our biggest priorities for Oley in the next couple of years, is to address exactly what you're talking about and all the things that you guys are saying.
It has to happen.
So I have about 10 people with their hands up, like dying to get to me. And I'm only going to be able to get to a couple, and I really apologize. I'm trying to take them in the order in which we did this. We're going to wrap up here in a few minutes, but I'm going to give a couple more questions.
Thank you. I guess one question I have for you would be, how does a patient become best friends with their body just the way that it shows up?
Great question.
I wish I had the answer to that. But I think everyone here would give a better answer to that question. I really appreciate, or even to step back, I believe that patients know their bodies better than I know their bodies, okay? And if a patient comes to me and says, something is wrong, okay, just because I can't find out what is wrong doesn't mean there's still not something wrong with you, okay? And that's very important for you to understand, okay? And I want people to know that you should trust your bodies. No one else knows your bodies better than you do. And just because someone hasn't given you a diagnosis means that someone just hasn't figured it out yet. And I know that it is exhausting to go through that journey to find that needle in the haystack, but the information is out there. And I would say you trust yourself.
Thank you.
Hi, my name's Andrew, and I also have chronic intestinal pseudoobstruction. And my key takeaway from this presentation is that there needs to be more DNA sequencing testing, because when I was trying to find the answer, that was one of the things that I think is so important, is you don't know what you're looking for, and until you can find it down to that very tiny level, no doctor is going to understand it, no researcher is going to understand it. So I had worked with a DNA geneticist, Dr. Malinsky, and he sent my blood and my family's blood to Yale, and they were able to do the testing, and they found the specific problem for my condition, and it's called MYH11 gene myosin heavy chain 11.
Easy for you to say.
And now that we have that information, now researchers can do more research and develop new ways to solve these problems that are so complicated. So I urge people to try and figure out a way to get DNA, the sequencing done.
That's an incredible story for you to share with all of us. There is such a lack of access to geneticists. How long did it take you to get an appointment with a geneticist?
Yeah.
Yes. So I also believe that, much like AI, genome sequencing, right, we have now the technological advances where we should be able to have precision medicine, right? Everything is going towards customization, precision medicine, and what we have as a system, and I talked earlier before about the silos, all of these diagnoses, okay, Ehlers-Danlos, Dupuytren's disease, these are just labels that we have put on collections of symptoms that we have seen repeated, but it's not as specific as HCB1 1125 short chain, that problem. So we are working in the system that we have. Your doctors should be your allies, your advocates. And my biggest takeaway is that I am very bullish on peer-to-peer health, learn from one another, because this one comment right here may spark something for your next conversation with your doctor. Do you think I could have a genetic component to this, that could then affect my child, my parents, right? You could be saving your family from a lifetime of issues if they are able to get their diagnosis as soon as possible. So I really thank you all for listening. Please, if you have any questions, come find me afterwards. Feelbetter.health is the sign up, and we'll have communication with Oley over email later. But I just want to thank you all and enjoy the conference.
So I know that there are several people who have their questions and their hands raised, and I apologize, we didn't get to everyone. And what I'd say is you can submit your questions directly to Dr. Nance. You can go to info@oley.org and just say Dr. Nance, and then we'll make sure that they get on to passed on to her. So please do that if we didn't get that. She'll also be available a little bit here to talk in the hallway and things like that. So I just wanted to say thank you for coming today. One of the things when I saw your story was so important to me is because sometimes the quiet part needs to be said out loud. I hope that some of you are seen today. I hope that there was one comment here or there that you were able to say, it's not just me. That was my story, is that I thought I was failing my kid. If I had just been a better advocate, if I had just said the right thing, if I lived in a better state, if I had better insurance, if I could just do this better, then I would not have my son suffering as much as he was. I took it personally. And as I connected to the community, one of the most important pieces that I heard was, oh, they did too. And I realized it's not just me. So if you heard nothing else in her story today, please know it is not just you. You didn't do anything wrong. You're not saying it wrong. You're exhausted. You're tired of saying it. I'll do it with one foot and singing in the rain if I have to be heard. And you will too. And we will fight for ourselves and our loved ones and our children and so forth. It is not just you. I need you to know that. If there are any doctors or clinicians or industry people in here, I'm going to say something also controversial. We have that in common. If at any point in this conversation today you heard yourself say something along the lines of, oh, like Jessica, all you needed to do is, I'm going to ask you to cause yourself to pause. Because if all they needed to do was fill in the blank, I'm telling you they would have done it. If they knew to do it, they would have done it. If we could have gone to a bigger center or had better insurance, we would have done it. And so I'm saying, please hear us when we say, oh, all you need to do is, that feels very dismissive. Mic drop. I don't think I've ever heard that said out loud, and I felt the need to say that at the end of this. So again, thank you, Dr. Nance, for being here today.
Welcome.
Thank you for being an advocate. Thank you for speaking our heart, and thank you for giving us a chance to hear your story. Thank you so much. Would you please give her one more applause?
Thank you.